Welcome my friends and my brothers and colleagues from the medical career. Welcome to this your channel, Clinical Consultant, with a topic requested by one of my colleagues. Today's topic will be Acne Vulgaris. I hope it will be of great help to you. Definition. Acne vulgaris is a chronic disorder of the pilosebaceous apparatus produced by the abnormal desquamation of the follicular epithelium that determines the obstruction. Between the hair and the skin there are protective cells called epithelial cells. These cells shed and cover the duct that nourishes the hair of bait. This obstruction produces an inflammation and determines the formation of papules, pustules, nodules, eaters and scars. Classification of acne. Acne can be classified according to the type of injury. Comedonian, that is very common, papulopustular, and nodulocystic acne. I leave the images for you to recognize each one. Classification of acne according to the American Academy of Dermatology. It is classified into three forms according to its severity: in mild acne, moderate acne and severe acne. Moderate acne is characterized by the presence of few or more papules and pustules but without nodules. Moderate acne is characterized by the presence of several to many papules and pustules along with nodules. Severe acne is characterized by the presence of many or extensive papules and pustules, with many nodules. Epidemiology and Demography. Acne is the most frequent skin disease in the United States of America, and in the world. It affects mainly adolescents and young adults between the ages of 16 to 24 years. Among its signs and symptoms we have open comedones, also called blackheads, and closed comedones, also called whiteheads or pimples, oily skin, presence of scars from previous acne cysts. Various stages of development and severity appear concomitantly. Bone, that each time they appear they can go from bad to worse. The most frequent distribution of acne is the face, back and upper part of the thorax. We can also see the presence of papules, pustules and other ectasics with inflammation. Etiology. First, there may be an overactivity of the sebaceous glands with blockage of the ducts. The obstruction determines the formation of comedones, which can be inflamed by the excessive growth of Propionibacterium acnes. This can be worsened by environmental factors such as heat, humidity and tropical climate. It is important to say that those very northern countries that have a very cold climate always, it is strange to see people with acne problems. Also, another thing that makes it worse are medications such as iodine in cough preparations and hair glitter, industrial exposure, and halogenated hydrocarbons. Differential diagnosis. We must differentiate them from gram-negative folliculitis, staphylococcal pyoderma, pink acne, drug eruption, sebaceous hyperplasia, angiofibromas, meat and skin osteoma. These last three are very rare and we should not suspect something like this at the first. Also exposure professional to oils and fats, and finally acne due to steroids. If you are a person who uses steroids and suffers from acne, in order to get rid of acne you must stop using steroids. Assessment. From the anamnesis and physical examination we must inquire about previous treatment, previous pharmacological history, family history, history of outbreaks with the menstrual cycle, history of use of cosmetics or cleansing milk and use of oral contraceptives, since all these can influence the worsening symptoms. Lab tests. First of all, it must be said that laboratory assessment is not usually useful. Patients who are candidates for isotretinoin treatment should have their liver enzymes, cholesterol, and triglycerides measured as baseline, because this drug can increase lipids and enzymes. In women, a urine result should be obtained 1 week before starting treatment with isotretinoin. Effective contraception is also mandatory during treatment and a month after finishing it because it has a teratogenic effect. That is, if you are pregnant it could cause genetic malformations in the embryo. In addition, a pregnancy test must be done each time to monitor it. In women with suspected hyperandrogenism, the concentrations of dehydroepiandrosterone sulfate, DHEAs, testosterone, total and free and androstenedione should be measured. In general, if the woman has regular menstrual cycles, it will not be necessary to measure serious androgenesis. Non-pharmacological treatment. It is possible to use blue light for moderate inflammatory acne vulgaris. The light of the blue-violet range can determine the death of the bacteria by means of a light reaction which the porphyrins will react with oxygen to generate reactive species of the same. The latter will damage the cell membranes of Propionibacterium acnes. Treatment may consist of 15-minute exposures twice a week for 4 weeks. Acute treatment. Treatment can vary depending on the type of lesions, which can be comedones, papules, pustules and cystic lesions, and also depend on the severity of the acne. Comedone acne treatment. Comedones can be treated using topical retinoids or their analogs. Topical retinoids are camdolytic, that is, it destroys them, and they work by normalizing follicular keratinization. The commercialized retinoids are, 1. Adipiolene. This is in gel suspensions or 0.1% creams, and this is applied 2 times a day. 2. Terazolidine in suspensions of creams or 1% gel, this is applied once a day. 3. Tretinoin, in suspensions of 0.1% creams or 0.025% gel, and is applied at bedtime or in microspheres. It is important to say that tretinoin is inactivated by ultraviolet light, boned by sunlight and oxidized with benzoyl peroxide, so that it can only be applied at night and should not be combined with benzoyl peroxide. Tretinoin is a Class C drug during pregnancy and terazolidine is Class X, so it should definitely not be used during pregnancy, and effective and demanding contraceptive methods should be used. Open comedones, that is, blackheads, must be squeezed out. Patients should be re-evaluated at 4-6 weeks. Benzoyl peroxide gel at 2.5 or 5% can be incorporated into the treatment of comedones, if the comedones become inflamed or pustules form. Side effects of this treatment include dryness, erythema, and flaking. Topical antibiotics such as erythromycin, lotions or clindamycin wipes, can also be used in patients with significant inflammation. They reduce the presence of P. acnes in the pilosebaceous follicle and exert some anti-inflammatory action. The combination of benzoyl peroxide 5% plus erythromycin plus clindamycin 1% have been shown to be effective in patients with mixtures of inflammatory and comedonian acne lesions. Pustular acne treatment. The application of tretinoin plus benzoyl and peroxide gel, on alternate nights, that is, if you do one tonight, the next night you will use the other. Do not combine them. Drying agents such as sulfacetamide sulfa-ions also result be effective when combined with benzoyl peroxide. Oral antibiotics such as doxycycline 100 mg daily or erythromycin 1 gram daily divided into 2 or 3 divided doses, that is, 500 mg every 12 hours or 333.3 grams every 8 hours. These are effective in patients with moderate to severe pustular acne. Patients who do not respond to these antibiotics can be switched to 50 mg minocycline every 12 hours, but it is more expensive and in some countries they do not sell it. Treatment of nodulocystic acne. These can be treated with systemic agents such as antibiotics such as erythromycin, tetracycline, doxycycline and minocycline, isotretinoin or oral contraceptives. The intralesional application of triamcinolone injections by dermatology is also effective. A possible endocrine pariah should be evaluated in patients who do not respond well to treatment. Treatment for antibiotic-resistant acne and severe acne. Isotretinoin is indicated in doses of 0.51 mg per kilogram per day, in 2 divided doses, maximum 2 mg per kilogram per day. Also divided into 2 doses per day. The duration of this treatment is 20 weeks with cumulative doses of 120 mg, kg or more in cases of severe cystic acne. Before using this drug, the aforementioned laboratory studies should be carried out, since this drug is super contraindicated during pregnancy since it is teratogenic and can cause congenital malformations. We must also be careful when administering in patients with a history of depression. To prescribe this drug, the doctor must be part of the manufacturer's SMART program. Azelaic acid is a bacteriostatic decarboxylic acid. When we say that it is bacteriostatic, it means that it reduces or neutralizes bacterial replication. It is used to normalize keratinization and reduce inflammation. Oral contraceptives reduce the concentration of androgenous and the production of beta. They are a useful complement for the treatment of all types of acne in women and adolescent girls. The most used compounds are norgestimate, ethinyl estradiol and dorsprenone, ethinyl estradiol. Derivation. The referral for intralesional injection and dermal abrasion should be considered in patients with severe acne who do not respond to treatment, and as always these should be referred to a dermatological specialist. Other considerations. Gram-negative folliculitis should be suspected if acne worsens after several months of oral antibiotic therapy. Acne can get worse during the first 3 to 4 weeks of retinoid treatment before it gets better. So if you notice a quiet worsening, it is normal for it to get worse before it gets better. Comments on the subject. The indications for systemic treatment are deep and painful papillae or nodules, extensive lesions, native acne with significant scars and hyperpigmentation, and patient morale. Something very important that you should know that most cases of acne can be controlled, but they are not cured, and that it took at least 4 to 6 weeks to see a significant change. Do not expect the medicine to take effect one moment for another. Thank you very much for watching the video. Like the video and subscribe to see more of my content. Greetings.